Hello, everybody. I am Dr. Shekhar Biswas, and I am a practicing pediatrician and working in North Zone Rohini, and also consultant at Jaipur Golden Hospital Rohini. So, something about me, like I did my MBBS from SN Medical College Jhansi and MD from SN Medical College Agra, and did my SRship from Lady Harding Medical College in Delhi. After that, I am practicing for past 10 to 12 years. And thank you. I would just thank the Baby Chakra app for giving me the opportunity to speak on this platform to all of you. So today, just a type of teaser where we want to share why unvaccinated child should not go to school. So why we have chosen this topic today? We chose this topic because we all know we have gone through the pandemic. Pandemic is still there, but still there was a havoc for past 2 years when we had the first wave, then we have the second wave, which was very deadly. Then came the third wave, and so on. So because of that, most of the kids, or approximately all the kids, were at home. There were no schools. They were not allowed outside, and ultimately, what had happened? Their primary vaccination or their boosters have been missed because parents were apprehensive to bring their child to the clinic because they thought if they will bring their child to the clinics, they may even catch COVID. So ultimately, most of the children did not receive the boosters or the primary vaccination in most of the scenarios. And we are seeing such patients coming to our clinics also. And that is very unfortunate when we see a any disease which prevented vaccine and the child who is coming to the clinic with that disease. For example, we talk about typhoid, flu, chickenpox, hepatitis A, meningococcal vaccine, and so on. The list is so very long. But ultimately, these are some diseases which are prevalent in the society. And maybe as parent, you have not got those vaccination for your kids due to some or the other reason. And the most common reason was COVID. Because ultimately the lockdown, kids were at home and you were apprehensive. But I think now everything is open and we are taking all the COVID appropriate etiquettes or the precautions. So we know how to tackle COVID. And as parents, we are going to our offices, also doing our day-to-day jobs. We are going outside for recreation purposes like going to restaurants or malls or shopping complexes. So ultimately now it's a good time when you can bring your child to your pediatrician and show them the card, what are the vaccines which they have been the child has missed. And this is also catch up vaccination, and catch up vaccination will help the child rather in clearing those diseases or getting immunity from those diseases. So that's why I urge all the parents, please try to get the vaccination chart up to date of your child. See your child's chart, see whether the vaccination are proper or there is some missing vaccines. Go to your doctor, pediatrician, ask them about the catch-up vaccination and get the proper vaccine at the time. I think this is most important and prudent for your child. So we will have some general questions which may come in your minds, and I will try to answer them. The first question which has come to me is that is it compulsory to vaccinate the school kids against the COVID vaccine? I think this is a very prudent question which comes to the mind of all the parents that COVID-19 vaccination is important or not. Yes, it is very important. We all know how these vaccines helped us tide over the crisis of COVID. And as a pediatrician or a doctor, we have taken the vaccine, I think, before the general population. And I think I was working, I never sat down at my home. I was working in my hospital, going to my clinics. I was doing everything according to the COVID appropriate behavior, and I got the vaccine. And luckily, I was fortunate enough that I had some symptoms of COVID in the second wave, but they were very mild. And I give the due credit to the vaccine because of which I was having those mild symptoms. Talking about children, we have vaccination till 12 years and beyond, till 18 years. So if your child is 12 year plus and up to 18 years, please get them vaccinated, register on the COVID platform, see with the nearest vaccination center at nearby your home, and get your child vaccinated. And soon enough, I think government is going to announce the vaccination for the kids below to 12 years also. I think first it will be 5 to 12 years, then 2 to 5 years. Till then, I think we should wait, and all those children who are beyond 12 years of age, the parents should take the first chance and get the child vaccinated. That is very important to prevent COVID infection. When we talk about the second question is, what vaccine should I give to my 5-year-old? A 5-year child is good enough because if the child has got the primary vaccinations, which are below the age of 18 months, which includes DPT, Hpv, hepatitis B, pneumococcal vaccine, rotavirus. Then at 6 months, we give swine flu vaccine, typhoid. At 9 months, MMR, 1 year hepatitis A, followed by 15 months, we give chicken pox, and 16 to 18, we give the booster for this DPT, HIV combination. After that, the hepatitis A booster at 18 months, and meningococcal vaccine at 2 years of age. And this is a standard guidance set by Indian Academy of Pediatrics. So this is a very exhaustive list. And if your child is less than 5 years, please check at 5 years again. The second and the third boosters of DPTs are required. If your child has received 1 dose of chickenpox, you require the second dose of chickenpox. And talking about swine flu, you require a yearly shot because as you see in the COVID, the virus mutates. That means it changes the form, and you require a new vaccine every year for flu. So these are very important. One more question has come: what precautions should I take for 6-year-old if he is not vaccinated in COVID? Basically, for all those who are vaccinated or not, you have to take all the precautions or COVID appropriate behavior. You have to sanitize your hands frequently. Do not touch your eyes and nose. Wear a proper mask, surgical or N95, and again keep a distance of 2 feet from anybody who is in the general population. And if somebody is sneezing or coughing, I think you have to keep more distance. So these things have to be taken care of apart from the vaccination. So if we don't have the vaccines for below 12 years, that doesn't mean we have to uh, loosen the guard, or those who have got the vaccine, they should loosen the guard that yes, I have vaccinated, so I don't need to follow COVID appropriate behavior. So COVID appropriate behavior has to be followed by each and everybody, irrespective of his vaccine status. One more question has come is, are the government recommended vaccines taken in school are must to take? Must and government vaccines or the private vaccine? I will just clear this out. One is the EPI or the UPI, that is the Universal Vaccination Program given by the Government of India or any government funded vaccination. These are the bare minimum vaccines which have to be given, and we should not avoid them because ultimately it is providing the child's immunity or improving the child's immunity against the vaccine preventable diseases, which are 7 diseases, which include diphtheria, pertussis, tetanus, hepatitis B, injection polio, your polio, normal polio, and hepatitis B. Even now, we have rotavirus vaccination and pneumococcal vaccination available in the government setup. Apart from that, there are other vaccines also which are important, like which are not there in the government setup. We call them schedule. That is the Indian Academy of Pediatrics, where we have typhoid, we have flu, we have chickenpox, we have hepatitis, we have meningococcal vaccine, and so on. So each and every vaccine which is available in the market is protecting your child from some or other disease. So getting a vaccine, be it in the government setup or private setup, is very much important because it's like an insurance for your child. Because ultimately the child will be protected from the disease. Even if the child catches the disease symptoms will be very, very mild. Now, there is another question. My kid's school has recommended flu shot to be given for my 12-year child. Is it necessary? Necessary, I think necessary word should not be there for the vaccine. Vaccines I think the most important discovery in the mankind has been two things. I think science has given two gifts to everybody. One is clean drinking water if you have, and all the vaccines which are available, you get them. So ultimately, if you have clean drinking water and vaccination, you are protected from at least 80% of diseases. So you can understand how important the vaccines are. Even if you take the examples from the past, there was smallpox, which had created havoc during 70s and 80s. So many kids used to die, people used to be crippled, their face became so bad. Even we talk about polio, so many kids were getting paralysis, some were even dying due to polio, tetanus. We have conquered all those diseases. How we could conquer those diseases? Because of the vaccination. So you can understand vaccines are very important. And talking about flu shot, I told you earlier also, the vaccine's efficacy lies is only for 1 year. So every year you have to take flu shot, and it is very much important. And I think it is more important in those kids also who have comorbidities, like they have renal issues, any child has asthma, any child is having a cough or any chronic pulmonary disease, if a child has any kidney disease, or the child is having malnutrition or any GI disorders, that is uh, disorder related to your gut, then it is also very much prudent, because in those comorbid conditions, flu can even kill your child. So, what is the takeaway message? I would say take home message. So take home message for all the parents. I just urge them, please don't take the vaccination lightly. There is nothing called compulsory, necessary. Remove these words from your dictionary. Every vaccine is important. Ask your doctor, your pediatrician, why the vaccine is important. Get your child vaccinated, because ultimately it is protecting your child from diseases. And I will take this opportunity also talk about one more vaccine, which is HPV vaccine, that is human papilloma virus. This HPV causes many cancers. At least in India, statistics says 1.8 lakh adults get HPV disease or cervical cancer, which is one of the syndrome of HPV virus. And out of this 1.8 lakh, at least 50% die within 1 year. So this vaccine is again very important, which is preventing a bunch of cancer which is caused by this virus, which is human papilloma virus. Talk to your pediatrician, talk to your gynecologist, talk to your doctor, and get your child and yourself. As an adult, also you require many vaccines. Get yourself vaccinated. Thank you.